craniosacral myself, because even, I think this was at 10 months or something, I was just still having things pop up for me physically, and what prompted it? So it's a long story. I don't know how much to tell here, but I had injured my arm, and I hadn't been moving it much, and then I got mastitis on that side, on that breast, and I think it was because I didn't have the lymph moving on that side, so I got blood ducts and mastitis, and that's not typical at 10 months. Like usually when breastfeeding gets going, it is okay. You don't have problems. Lucky me. I got mastitis later, so I called you up and I said, do you do anything with lymph movement? And you said, oh yeah, definitely. So I started coming for that, and I think that's been really helpful. So I'm still kind of working on keeping this breast clear, but the mastitis is at least cleared up, and the craniosacral has just helped with a lot of things. You were able to look over my whole body and give me some help on balancing my pelvis, and kind of, I don't know what all you did, but it felt good.
Yeah, so that's where craniosacral bridges over into myofascial release work, that working with helping the muscles that are through in this case, the torso and the pelvis, and lower back, and everything.
They get, tight with all the nursing I'm doing. I'm always going forward. So I think what you did just helped release everything, and felt a lot more relaxed and open after the treatments.
Yeah, that's great. And so that sometimes that's part of. Sometimes it can be part of recovery from birth because, well, things can get off at the birth for women.
Oh, I totally wish I'd seen you earlier. I was seeing some other chiropractor and other practitioners, but yeah, I think you helped maybe the most with the soft tissue because I was having bone adjustments, but I wasn't having a lot of help with the myofascial part of my body. So yeah, I definitely would have come earlier.
Yeah. Well, because both the skeletal and the muscles are always affecting each other.
Yeah.
And so chiropractic is really, really valuable. And then, like, they can just pull each other off if they're out of balance. So, I think that you did like some sessions where they were very close together.
Yeah, so I would line up, when I had my chiropractic visit, I would line up so I would see you the next day. So I could do a combo of getting everything back in order.
Yeah, and then that can stabilize there.
Yeah, that's the goal. I feel more stable than a year ago, for sure, but I feel like I still have some work to do. So, anyway.
Yeah, I think that I think it would help if we would let more women know that postpartum recovery is a process that of and it's different for every woman. How the birth went and how like my alignment was going into the birth, and then.
I mean, I had a particularly intense birth, and I have scoliosis, so already I have a lot of misalignment in my body, so I don't know if it takes as long for everyone to recover, but it can. I think it can take a while, because it is such a big change in the body.
Yeah. Plus, if I ever fell off my bike and threw off my pelvis in a certain way, and then I got pregnant and had a baby, and it's like that old injury might show up as how the birth goes, or it might show up as how I recover, or what kind of discomfort I feel during the pregnancy or afterwards. So that's why it's so individual, because we have a whole history in our bodies, and now we've like added more amazing events to that, having a baby.
Yeah.
So, but I think if women were encouraged or supported to like tend themselves, and it's hard to do because it's, I mean, no wonder you didn't come until 10 months because you're taking care of a baby.
Well, and then we had the house project.
Yeah.
There was a lot going on, and it was hard for me to think about anything.